Um, my name is Gideon Orbach. I've been practicing chiropractic here at the Weiner Wellness Center for more than 13 and a half years, less than 14. I've been in practice general total close to 20 years, and I'm going to let you guys in on a little secret. I miss Phil. Phil I is our technology guru person, and he set up this wonderful studio that we have upstairs with Jeffrey Niznik. Um, and we have a light source and we have multiple camera angles, and I think Sony would be jealous of what we have here. But Phil's not here today, and I'm having a little glitch with the technology. So I'm actually on my phone right now, holding it up. So if we go a little shaky, or if we go a little off angle, or you see any my head moving around too much, we're just rolling with it. This is adapting and overcoming, and I'll explain what that means more in just a moment. So anyhow, as I mentioned, I've been practicing here at the Weiner Wellness Center for more than 13 and a half years. And yes, I am keeping count. It's kind of exciting to have this kind of longevity and to build up this kind of relationship with a certain group of patient population, which is growing, by the way. There's more, there are more room for more patients to join our growing family. To be in one location for all this time, it's meaningful stuff to have this kind of longevity in a chiropractic career. But anyhow, as I was beginning to say, I practice neuromusculoskeletal chiropractic, and what that means is that I'm interested in the working relationship between body parts, specifically the way muscles and connective tissue and the skeleton interplay with one another, and how that affects the nervous system, and how we can improve people's overall global health by making adjustments and manipulations and doing work to get their muscles to loosen up and their skeleton to move through their full range of motion, and how that will influence the brain, and how in turn the brain will influence the body as a result. So in order to better explain all of that, I think the first thing that we have to do is establish some common ground. And by common ground, I mean let's define the word health. Well, once upon a time in a pre-COVID era, all these workshops were live and in person, and I think it's exciting to use the technology and to be able to reach so many more people all across the land by using the platforms that we have available, and the the cameras and the phones in this case, and the computers, and seeing people signing in from all over the world. But I kind of miss that interaction that I used to have when I was hosting my workshops, which I refer to as conversations. And inevitably, there would be somebody, usually sitting in the front, who'd play with me a little bit, and I would play back, and they'd try and draw me off point, and I would try to draw them back on point. And there was this fun little interplay of banter back and forth between me and the crowd, and that was part of the experience. So in light of that, I want to make sure that everybody who's listening in knows that they're invited to participate by putting information in the chat box, by asking questions. And if you draw me off point just a little bit, we can live with that as long as we're being productive and answering relevant questions. So don't sit on your fingers. But anyhow, one of my favorite questions that I began workshops with was the question is, how do you define health? That I think all of us want to be healthier. We come to places like the World of Wellness, the Weiner Wellness Center, formerly the Pain Release Clinic, in the hopes of consulting with people like me, like my colleagues, Dr. Joseph Honigman, Philip Ross, Jeffrey Niznik, now Ashley Rozzi. We still have a great crowd of people who are capable of helping out our clientele, and the clientele says, I want to be healthier. But before we can do that, let's establish a little common ground and some boundary definitions, and let's define the word health. And this is the point where I invite people to work in the chat box or to raise their hand and blurt out if we were all live together. But I'll just give you my definition. And in order to be healthy, I think that means you have to have the ability to recognize, interact with, adapt to, and overcome your environment, both internally and externally. To recognize, interact with, adapt to, and overcome your environment, both internally and externally. So what's our internal environment? Our internal environment is the neurochemistry that exists between the way our brain talks to our muscles, our connective tissue, our joints, our skeleton, our digestive organs, Our brain is communicating with the heart, with the immune system. All of these body parts, all these organs, and all of these systems have constant communication with the brain, and the brain will regulate one to the next and make sure that we are functioning as optimally as we possibly can. So a moment ago, I told you all that I'm standing here holding my phone, talking into it. Uh, um, I can walk around the studio a little bit and give you guys a quick tour. This is my external environment. We talk about the internal environment in the context of your brain-body communication and how your body sends messages to your brain, and your brain regulates the body accordingly. And those messages might be enhanced by good nutrition. They might be enhanced by better biomechanics, is how your muscles and your skeleton work together. And the external environment is who's around you. How are you reacting to the traffic going by? How are you reacting to difficulty getting on a computer and picking up your phone and saying, I'm just going to hold my phone up and shine the light on my face this way, and I'm going to make this presentation in such a way that you guys can have a tour of the studio and what it looks like in here, rather than, I don't have a computer, it's not working, I guess I better, anyway, I'm not going to fold. So anyhow, this is an example of me, with the help of Dr. Tracy, interacting with and adapting and overcoming the environment. We're all healthy here. So the next word that I want to, the next concept that I want to make sure that we have talking points about, and that we're able to define and to come to some sort of common ground with some sort of understanding of what we're getting at, is the word pain. Pain is a warning system. Pain is your body sending your brain a message to say, something's not right here. We're going to have to do something about this. We're going to have to take action on our own behalf. We're going to have to improve our quality of something in order to gain better function. Along with better function, optimal function means a decrease in pain. So we can't ignore pain when we experience it. But by the time we experience pain, we've already allowed whatever condition that's causing that pain to persist for a while yet, because pain's not the first system to appear, or the first experience to appear. And pain is defined as an individual emotional response to a noxious stimuli. So pain is individual specific. For example, if one person trips and falls and another person trips and falls, and both of them have a very similar injury in terms of how they land, one person might scream bloody murder and want to go to the emergency room in the ambulance. The next person might say, that's too bad, get up and brush themselves off and continue with their little travels and hiking onward. Now, who was right and who was wrong? Neither. Nobody overreacted to the stimulus. Nobody underreacted. Pain is individual subjective. That means each and every single one of us has our own pain threshold and our own level of pain tolerance and our own reaction. And there's no right or wrong. There's some people who have a greater pain threshold than others. All of us have one at a certain point. We certainly don't want to reach it, but we don't want to say that one person is more right or one person is more wrong based on how they react to their environmental stimulus. Now, that being said, if pain is an emotion, I'm sure every single person tuning in and listen has either heard at one point, or knows somebody who's heard, or somebody has told them that pain is all in your head. And that's absolutely true. That is completely and absolutely, where else would you find an emotion living? Pain is a neurological phenomena living in your brain, which lives inside of your head. So here's the question. What are all the things that can cause pain? Well, we can get out an 8.5 by 11 and start filling up all sorts of different noxious stimuli that might cause somebody to have an individual emotional response that would trigger pain. But the big ones are, it could be an environmental stress. It could be a nutritional deficit or a nutritional surplus of having the wrong stuff. Or it could be the way the nervous system, the brain and the body communicating with one another through the free nerve endings and the peripheral nerves throughout the body are having a miscommunication, or they're having a neurological misfiring. So I don't want to deny or belittle anybody's experience. There are some marvelous practitioners who deal with all sorts of different types of pain generators and pain sources of origins. Me, I live in a place where I deal with the physical. I'm interested in circuitry. I'm interested in push-pull relationships. I'm interested in function. I'm interested in how the body works together as a series or as a collection of parts that are going to work together and are going to influence the brain to receive the messages that would deal with optimal function as opposed to painful stimulus, painful function. Um, Anyway, how am I doing with the phone and the camera and making sure that
You're doing good.
everybody can see, not blocking things out? So far, so good.
Yeah, you look great. Doing good. I hope your
All right,
deltoids are holding up.
all right, good, good. All right. So the $1 billion question, or the $100 million question, or I don't know how much money we spend in this country dealing with loss of productivity, treatment, uh, um, perhaps unnecessary surgeries, rehab from surgeries, rehab from injuries. I mean, there's certainly a time and a place for all of those things, but I'm going to submit to you that we as a country spend way more than we need to just treating pain in general, treating back pain in specific, lower back pain in more specific. And so we got to ask better questions and say, what are we going to do to get ourselves out of pain? What are we going to do from a low tech perspective? From a like this is I don't need a lot of equipment to do my exercises. I don't need a lot of sophisticated equipment to deliver a good treatment plan. What am I going to do to advance my own cause and to get myself out of pain and start to feel good? Well, first of all, I want to suggest, as a practitioner, it's a mistake to chase pain. It's a mistake to say, well, the body hurts in a certain anatomical location, so that's the only spot that we're going to treat. It's a mistake to take pain-killing medication or medication that dummies down your nervous system and prevents you from feeling the noxious stimuli that's causing your neurochemistry to react in such a way that you cause pain. We're not pain chasers at this clinic. I know a lot of very good chiropractors who are pain chasers. Most of the medical model is a pain chaser. I'm not saying there isn't a time or a place. I'm saying it's not the place to begin, and it's a mistake to go down that pathway for too long, that pathway of treatment for too long. If you're not seeing results immediately, it's time to do something else. I think that the best way to treat pain, or at least pain generated from a neuromusculoskeletal perspective, from the way the body and the brain are talking to each other, is by treating the body. Let me illustrate what I mean. In fact, you know what? Before I illustrate that, let's do a little bit of low tech rehab together right now on the platform. When I'm looking for specific exercises and specific rehab techniques to help my patients improve their global function, the two things that I'm most interested in, actually, I take that back. The three things that I'm most interested in are: one, a patient's posture; two, the way they breathe, which is enhanced through posture; and three, the way they walk. So when I deal with a treatment plan with hands-on treatment for a patient, and when I assign them exercise, or I don't assign anybody anything, when I suggest exercises for a patient to work on their own, initially all of those exercises are going to deal with either improving the way they walk, improving their posture, and or improving their breathing mechanics. So what I want to do is I want to work on a quick posture exercise. I want to illustrate how important that posture is in order to breathe deeply. And then I want to continue with the workshop at hand that we're going to get into how I influence the nervous system to increase function and thereby decrease pain. So let's think about our posture for a second. One of the advantages to being on your phone and not locked into the computer is I can stand and I can walk around the studio, and I can illustrate this better from my phone than I can sitting at the desk. So I'm interested in the area of my body where my belt buckle lives, right here, to my midsection, which is going to be at the very top of my abdomen, the bottom of my chest, where I have my sternum. My sternum comes to an end, and then it turns into a little piece of cartilage that's tender to the touch on most people, including me. Um, and that little tender piece of cartilage is going to be called the solar plexus or the xiphoid process. So we have xiphoid process down to belt buckle. And I want to make myself as tall as possible. I'm making myself long in that region of my body. And what that's going to do is it's going to force my chest to come up, and I'm going to throw my shoulders back. So I'm going to take my shoulder blades, the wing bones in the back, and I'm going to try and touch my belt with them. That's not going to happen, but that's the direction I'm moving them. So I have my torso is very long. I'm as tall as I can possibly be, and my shoulders are thrown back, and I'm kind of going to be locked into that position. And if you're in front of your TV or your computer monitor listening in, please don't do this if you're listening in the car, but just stand up for a second and indulge me and try and stand in that position. If you can't stand up, second best is sitting. So it's okay to do the drill sitting down. It's just that we're going to talk about good, better, and best will be standing. Now, I have a lot of if you want to get a hold of me, the best way to do it is to send me a message on Facebook. People call on the phone and leave me a voicemail, and I check that every few days. I don't know what happened. I'm just not wired to be checking my voicemail. Those Facebook messages, that's like a drug to me. I check those between patients. I check those before and after I go to the bathroom. I can't help it. I'm just Facebook message. If you want to get a hold of me, that's the way to do it. Anyhow, just this morning, somebody sent me a Facebook message in which she was describing her experience taking ballet and said that her ballet teacher told her to attach an imaginary string to the top of her head and lift her head this way to reach for the ceiling. So we got our torsos long, we got our shoulders thrown back, and we are imagining that our heads are being lifted up, and we are as tall as possible. So if you go to the doctor's office and they measure your height, that arm comes out of the scale, and you think about standing up as tall as you possibly can in order to make yourself tall. Where that arm comes out is to the tallest point of your head. So that's going to be our ideal posture. And what I want you all to do while you're standing in this ideal posture is you should feel kind of relaxed, almost like your body is not straining to hold itself the way it might when you slouch down or slump down, and all of a sudden more tension or more torque is put on one group of muscle or one aspect of the skeleton that's really not designed to hold it. So this should be an awkward position for people who aren't used to it, but it should be a position that you can get used to very quickly and feel very relaxed in a standing position. So what I want you to do from this standing position is everybody's going to take a big deep breath in through their nose. And we're just going to hold it without shrugging our shoulders up. We're just simply inhaling through our nose. And we're going to hold it for 1,001, 1,002, and blow out through your mouths. Again, in through your nose. We're holding some more, and blow out through your mouths. And what you should find is how comfortable you are breathing in and holding it and blowing out, and how much more air, how much more oxygen you're capable of consuming when you're standing in good posture or sitting in good posture. And I want to highlight how important that is, because we talk about all the nutritional supplements that we have available here at the World of Wellness Center. Used to be the Weiner Wellness Center, used to be the Pain Release Center. State-of-the-art nutrition store with some very, very smart, nutritionally inclined professionals who are able to help you pick out the right stuff. But none of that matters if you're not getting enough oxygen to fuel all your metabolic pumps. So far, so good?
All good.
All right. Okay, let's get back to the matter at hand. And I was about to tell you my answer of how do I use the body to treat the body, to influence the brain, to allow better function, better ranges of motion, decrease muscle spasms, general more comfort living in the body in order to decrease pain. So I'll tell you my dental floss story. If I take a string of dental floss and I tie a knot in it and I put it between my two bottom front teeth right here, and somebody else grabs the dental floss from the far end and they give me a hard, sustained pull, I'm going to have a friction rub, my gum's going to bleed, and it's going to hurt, right? But my real problems are going to be here at the hinge of my jaw, because as somebody pulls the bottom aspect of my jaw forward, these relatively small but very dense and powerful muscles are going to be recruited to play tug of war against that person who's doing the pulling. Those muscles are fantastically strong when it comes to chewing. I know everybody listening in has bitten into a tough piece of steak. And if you're a vegan, I'm sure you've chewed gum at one point. And if you've never chewed gum, you've at least chomped on an apple. It takes a lot of strength to crush an apple. So our chewing muscles are some of the strongest muscles in the body. And if you measure them out size versus size, and form a comparison between how much stronger, much bigger muscles surrounding your hips and thighs might be compared to the relative strength versus the relative strength of the chewing muscles, I'm going to suggest that the chewing muscles are the strongest muscles in the body. However, just because they can play tug of war and compete with you and try and retract my lower aspect of my mouth backwards and play that game of tug of war with whoever it is that's pulling on the dental floss, just because they can doesn't mean that they should. They're not that strong on that plane of motion. They're strong on a chewing plane of motion. So those muscles are going to fatigue. They're going to spasm. They're going to tighten. They're going to inhibit my ability to open and close my mouth and to chew my food properly. Hopefully everybody can see that. My TMJ, my temporal mandibular joint, is not going to be able to open and close the way it should. Now, living inside of that joint, just like any joint in the body, whether we're talking about the sphenoid bone buried deep within the skull, whether we're talking about the atlas axis occiput complex, which is at the top of the cervical spine and literally holds the weight, or is designed to hold the weight of the head, or whether we're talking about the condyles of the knee or the cuboid bone in the foot, it doesn't matter. A joint is a joint. They all have very similar properties in the sense that living in the joint space, we have receptors. These receptors are called mechanoreceptors. They're pressure sensitive. And when the joint moves the way it's supposed to, those mechanoreceptors send information to the brain, in which the brain will interpret as, where are we in space? Where's our position? How open is this joint? How closed is this joint? What do we have to do to coordinate the rest of the body to behave in response to that particular joint? And all that's happening at a subconscious level. You have no control of it. I don't know why you'd want to have control of it, because it's a good thing. It's how your body is designed to work optimally. It's exactly what we want to have happen. So we have all of those mechanoreceptors that are pressure sensitive are now becoming dormant, because the jaw, the hinge of the jaw, is not opening and closing the way it should. Instead, what's happening is a different type of receptor called a nociceptor is sending information to the brain. The nociceptor comes from nocere, or harm. And what the nociceptor is telling the brain is, hey, we're going to clamp this down. We have to recover. Tissue is being destroyed. Body parts are being damaged. And if you want to start experiencing a little bit of pain and giving us a warning signal, now would be a good time. We start to lose circulation, intact circulation around the jaw, and the whole thing hurts. So what are we going to do to fix it? We got to do three things. First of all, we got to get rid of the resultant inflammation. Inflammation is a chemical process. We solve chemical problems with chemistry. This is one of the places where good nutritional supplement comes in better than in handy. And I think that ginger, turmeric, the proprietary blend called X-Flame, fish oil, those are all high potency, high value, quality anti-inflammatories. The second thing that has to happen is we got to repair the mechanics of the hinge of the jaw. We got to maneuver and coax and maybe even force the hinge of the jaw, the TMJ, the temporal mandibular joint, to move through its natural and normal preordained ranges of motion as comprehensively as possible. What's that going to do? we're going to get those pressure sensitive mechanoreceptors to fire. They're going to send information into the brain that says, hey, this is where we are in space. It's time to tell those nociceptors to just shut up, quit feeling pain. Our function is beginning to restore, and it's okay to go ahead and start producing natural endorphins and enkephalins, and we're able to start feeling good. The third thing that has to happen is somebody's got to quit pulling on the dental floss. Otherwise, we're going to do the same thing over and over again. And all that hard work that we've done to get the jaw to maneuver and to come out of spasm and to do what it's supposed to do is all for naught. And we're just going to repeat the exercise over and over. So far, so good?
All is well here.
So anyway, muscles, tendons, and the skeleton behave the exact same way. A muscle, or more realistically, a group of muscle or an action of muscles, are going to spasm. They're going to tighten, and they're going to pull in a direction that's disadvantageous for us. We could be talking about muscles that act on the shoulder blade and the upper arm and prevent us from raising our arm out to the side or lifting it out in front of us. We could be talking about muscles in the lower back when you're sitting in a slouched and slumped posture. Those muscles are going to be recruited to help support the weight of the torso in a manner that's just disproportionately more than they're capable of, or disproportionately more than they're designed to, if we're sitting in the kind of posture that we discussed a few minutes back, which we'll run through again in a couple of minutes. We could be talking about muscles in the back of the neck, where if we're sitting in that aberrant posture, our heads are allowed to drift forward so that we're able to better see our computer monitor. We talked about that in the posture at workstation workshop earlier in the week. We could be talking about muscles in the lower leg that allow us to plantar flex or dorsiflex, which means stand on our tiptoes, stand on our heels, limiting the range of motion at our ankles. It doesn't matter. We're talking about a group of muscles. They all might do different things in different places in the body, but they do very similar things in the aspects that they contract and expand and they stretch and they compress. We want to avoid that compressive state. And so based on our posture, based on our activity, based on our slip and fall or our injury or our repetitive movement or any number of reasons, a group of muscle has spasmed, tightened, and pulled in a direction that's disadvantageous to us. Muscles all attach to tendons. And tendons are a lot like the dental floss in the story that we talked about a few moments ago. The tendons are a fixed length. No matter how hard you pull on the tendon, it doesn't stretch the way the muscle will stretch. Muscles have what are called contractile proteins, and that allows for so much more flexibility, whereas tendons don't have that kind of contractile protein. Instead, they have what are called a Golgi tendon apparatus, and that Golgi tendon apparatus, instead of allowing for stretch, it recognizes stretch and said, this is not a good thing for us. We can only stretch but so far. And so when the Golgi tendon apparatus is activated, now we start to have that effect on the joint, similar to where the TMJ, the temporal mandibular joint, was playing tug of war in the wrong direction. So the tendons are a fixed length. They're being exerted. A greater force is being exerted on them and pulling asymmetrically relative to what they're used to by these tight spasm muscles. And so in response, what do the tendons do? They're going to inflame. They're going to swell. They're going to become irritated. They're going to activate nociceptors. They're going to activate free nerve endings that signal pain transmission. And the other end of the tendon attaches to a bone. And where two bones come together, we have a joint. So whether, once again, we're talking about the atlas axis occiput combination in the upper part of the neck holding the weight of the head or supporting the head, whether we're talking about the way the fifth lumbar vertebrae articulates with the sacrum in order to allow both stability and specific movements that the lower back is capable of making and should make, and prevent movements that it's not supposed to make, whether we're talking about the way the talus bone moves in the ankle. It's irrelevant. All these joints are at different places in the body, but they all have those common properties where the pressure-sensitive mechanoreceptors have become dormant. We're getting less neurological feedback, less information into the brain, and we are starting to experience more pain, more discomfort, loss of range of motion, stuck in a cycle that perpetuates itself, um, and generally feeling uncomfortable living in our bodies. And as a good friend of mine described the body, the only true home that you know. So, neuromusculoskeletal chiropractic. We got to repair the mechanics of the hinge of the jaw. That means we're going to find the joints that are not moving the way that they're supposed to. And we're going to manipulate and coax and put pressure into the joint and maybe even a little bit of force into the joint. And sometimes you hear a popping noise, that's nitrogen gas expanding. Sometimes you don't hear a popping noise, that doesn't matter. I love that noise. I wish everything I touched made that crisp popping noise that was the sound of a crisp adjustment. It doesn't work that way. Wishful thinking. Anyway, so we're going to repair the mechanics of the hinge of the jaw in that fashion. We got to get rid of the inflammation. As I said earlier, so many good natural health anti-inflammatories, the ginger, turmeric, the X-Flame, fish oil, the list just goes on and on. We want to get rid of the tension on the dental floss. That means we're going to get tight muscles to come out of spasm. So I like to do a little bit of trigger point muscle therapy. I like to do a little bit of active and passive stretching. Active stretching means the patient is going to help me move their body. Passive stretching means I'm going to move it and the patient goes independent for a moment. And we're using those techniques to improve the ranges of motion. We can reinforce those techniques through nutrition, of course, using magnesium, B vitamins, especially B6, but really a B complex, even fish oil once again. We're using the nutrition to support the action of releasing tight muscles to get them to come out of spasm and to allow the whole push-pull relationships, the whole circuitry to relax and to function optimally. And when that happens, patients begin to come out of pain. No, not in the blink of an eye. I'm a little spoiled. I've been doing pretty well with patients over the last more than the 13 and a half. How many years is it anyway? More than the almost 14 years that I've been here, more than the almost 20 years that I've been in practice. I'm used to people leaving feeling a little bit better than they did coming in. Can't say that we're solving everybody's problems on day one, but like I said, we're almost always off to a good start using these maneuvers. Very often, I recommend or I refer my patients to see Adam. Adam is a muscle therapist. He has very pointy thumbs and very pointy elbows in a good way. He helps me by getting into some of those deep muscles and getting them to release and to relax and to come out of spasm to reinforce the work that I'm doing. Dr. Phil Ross is concluding his first week with us as part of the team. He treated me earlier in the week. I was very somewhere between pleasantly surprised and pleased at how comprehensive he was in terms of addressing muscles, connective tissue, and the skeleton. So I feel like there's safety in numbers, that I work with so many outstanding nutritionists, and now I feel like I have a musculoskeletal and neuromusculoskeletal colleague to bounce ideas off of and to work with. So that's a good thing to have on our team. And we're using these methods once again to improve patient range of motion function in the efforts to reduce pain. So far, so good, Tracy?
All right, all good, sir. You're good to go. Takes me a second to click on.
Cool. I want to run through our low-tech exercises one more time, and then get on with the same show that we're talking about. So once again, we got that string at the top of the head, lifting us up to the ceiling, making us as tall as possible. We are compounding that height that we're achieving by going to our xiphoid process, the bottom of our sternum, down to our belt buckle, and making ourselves as long as possible in the torso, which in turn throws our shoulders back, pointing our shoulder blades down towards our belt, almost feeling like this point in the middle of the sternum. If we were going to have a photo finish in a race, this point would, our chests are so up and our shoulders are thrown so back that right here, this point would crash through the photo finish tape first, and our heads are up. And what we're going to do is we're going to inhale through our noses, and we're going to hold that deep breath. We're sucking in as much of that delicious oxygen as we possibly can. And we're holding, and we're holding, and we're holding some more. And let's blow out through our mouths. Again, big deep breath in. And we're holding, and we're holding, and we're holding some more. And we're going to hold, and let's blow out through our mouths. Very good. One last time. Big deep breath in through your nose. And we're holding, holding, hold, and out through your mouths. Now, why is it so important to get so much oxygen in? Well, we talked about oxygen as really being the most important nutrient that fuels all of our metabolic processes, ranging from our ability to digest our food all the way through us to be able to have this conversation. If you're aggravated about what's going on in the world and you decide to have a protest, and some people go on a hunger strike, and some people go on a thirst strike, and some people decide they're just going to hold their breath until they get what they want, who's going to fold first? So oxygen is critically important, and more is better. What does getting more oxygen into your body do? Well, first of all, as I mentioned, every single metabolic process is oxygen dependent. But I'd like to highlight one specific event that I think goes really well with the workshop that we've been having so far. That is your cerebellum. Your cerebellum is the area in the back of your brain which is thought of, and correctly so, as being responsible to help with coordinated movements. Walking, the idea of stepping out with your right leg and swinging your left arm at the same time. Landing and then extending your left leg while swinging your right arm. Perfect example of a coordinated movement that's mediated by the cerebellum. So getting up out of a crowd and walking across the room to get to the bathroom without tripping over anybody. That's an important part of cerebellar activity and coordinated movement. Now, the cerebellum does something else that doesn't get as much press as what goes along with coordination, but it fires to inhibit the sympathetic nervous system. So the sympathetic nervous system is part of our autonomic nervous system. The sympathetic, think of that as your fight or flight. When we go into that survival mode, I'm going to survive, and I don't know if I'm going to stand here and fight or if I'm going to about face and run, but either way, I'm planning on surviving. That's our sympathetic nervous system. It's contrasted with our parasympathetic nervous system, which is our wine and dine and relax and digest, rest and digest aspects of our nervous system. Neither of which are under our voluntary control. And that's a good thing. One goes up, the other goes down. Our subconscious mind and the thoughts that you don't know that you're having, but you're having them, are going to control your survival instinct, and it's time to just chill out and digest your food versus everything else that occurs. So if you're in this sympathetic fight or flight state, your heartbeat is probably off to the races and doing this, which does what to your blood pressure? Of course, your blood pressure is going to come up. You're going to be maybe breathing shallow, and you're going to start to regulate your body temperature in such a way that I just got to conserve energy, and I got to survive. So as our muscles start to tighten as circulation, as we don't get enough oxygen into our blood to account for the circulation that's just off to the races, we could be feeling kind of wound up and uncomfortable. Our nervous system, our nerves communicate with one another by the diameter or the size of the nerve. So the nerves that convey painful sensation, that noxious stimuli, that nociceptor activity that we talked about a little bit earlier, they're the same diameter as the nerve influence the sympathetic nervous system, and they can form what's called an artificial synapse or an EFAPS. So if we're in a sympathetic state, the chances are very good that our pain is magnified or intensified, and it becomes a self-perpetuating cycle. So when we talk about what do we do to get the body out of pain, how do we improve by improving function? What we really want to do is we want to let our body shift to parasympathetic activity as much as possible and away from sympathetic activity. Now, please understand, the sympathetics are involved with our very survival. We're not saying this is a bad thing. We're saying that you don't want to live in a sympathetic nervous system most of the time. Most of the time, you want to be in a parasympathetic state and functioning in a rest and digest kind of slow motion type of experience. So the cerebellum is going to inhibit the sympathetic nervous system, which in turn allows the parasympathetic nervous system to take over. And because the cerebellum is so sensitive to oxygen, it can be depleted rather quickly. So if we're doing deep breathing exercises, if we're doing chiropractic adjustments and muscle release therapies that will allow the shoulder blades to move on the rib cage the way they're supposed to, allow the rib cage to expand the way it's supposed to, enabling us to drink down and to suck in as much of that delicious oxygen as we can possibly manage to pull in. Well, we're doing our bodies a service. When we think about exciting those pressure-sensitive mechanoreceptors and inhibiting those nociceptors, we're taking steps to move our bodies more into a parasympathetic state and out of a sympathetic state. And once again, when we come out of that sympathetic state, those EFAPs, those artificial synapses between the sympathetic nervous system and the pain pathways, they start to erode. And that's exactly what we want in order to use the increased function as a tool to start to decrease pain. So that's what I do all day. That's what I bet my career on. I do hands-on neuromusculoskeletal treatments, adjustments, muscle release, muscle stretching to the spine and to the extremities in order to help my patients feel more comfortable living in their body, the only true home they know, to improve their posture, to improve their ability to breathe deeply, to allow their hips to swing through both forward and backwards as they walk, to generally have a more comfortable biopsychosocial experience. I've really enjoyed my career up until this point. I continue to enjoy it. I have a long laundry list of patients that I've been able to help dramatically. And now with Dr. Phil joining us, it's going to be so much easier to schedule appointments. We have the two of us, we share techniques, and we scheduled a few times where I'm going to be able to teach him a few of my tricks. And, you know, he's been in practice for a couple years. He's got some tricks that I want to learn. So we're going to be able to have a stronger and more accessible neuromusculoskeletal department here at the World of Wellness. We have openings to start taking more new patients more and more. I know it's been difficult to schedule previously, but we're taking steps to make it better and to open up more time slots with an additional practitioner. If you're listening to me from the Pittsburgh area, we're located in Green Tree, which is conveniently located very close to the exchange between Highway 79 and Highway 376. So we're really accessible from all points in the area. If you're listening to me somewhere other than Pittsburgh and you're interested in the things that I have to say and you're interested in find a practitioner near me, as I mentioned, those Facebook messages like crack to me, like absolute crack. I'm going to wind up my workshop any minute now, and I have a patient scheduled for any minute now, but you better believe I'm going to be checking my Facebook messages between now and the time that I start with my my next patient. perhaps I know somebody in your area, or perhaps I can help you find a chiropractor in your area. So don't be shy to reach out and just send me a message to say, I heard your presentation. I'm interested, but I live in somewhere not Pittsburgh. I want to thank everybody for their very kind attention. I want to thank Dr. Tracy for making all of the Zoom and technological presentations possible. I want to express to Phil how much your absence speaks volumes. I've done this whole presentation holding my phone up. I'm sure you guys saw a lot of shaking, and I appreciate nobody saying anything about it, but it's true. So it would have been a lot easier to do on the laptop. And Phil, your absence proves your value. So I'm looking through the chat box to make sure that there are no questions, no comments, no moral outrages, nothing that I have to address.
Tracy, oh, good, sir. Yeah, it was great. Yeah, you did a good job. And, you know, your shoulders, thanks. I can tell, very well defined now.
Okay.
All right, switching hands.
Thank you all very much for your kind attention and for joining me in this workshop. And I look forward to more. Bye.
Absolutely. Thank you, Dr. Orbach. Have a good day. All right, guys, stay tuned because we have the roundtable coming up next, and we're going to be talking about exposing the medical model.